Good morning, everybody. I am Shanna Rosentrader, and I am a licensed mental health practitioner here in the state of Nebraska. And Girl Scouts has asked me to put together a presentation for their career and entrepreneurship line. And this is part of the Girl Scouts at Home programming, which is super exciting. And the content is brought because I guess GSAC girls across the state have asked for more information based on their own experiences, but because they want to be more helpful, which is awesome. I will talk a little bit about my career throughout this, so I don't want to bog you down with a whole bunch of information up front. But we attempted to go live this morning and it just didn't work. So I have put together a quick careers presentation, and then at the end we'll talk about the next step, which is hopefully a bigger, more in-depth presentation sometime here in the coming month. So let's get started. Let me share my screen with you. And PowerPoint are us. Here we go. Okay, so mental health is a really broad term, and there are different levels. So I am a master's level clinician. So I graduated high school, I got my bachelor or undergraduate degree, and then now I have had my master's degree and I'm licensed. So there's different levels to work within this career. And one of the great things about mental health in general is that there's so many different ways and areas of specialties that you can take. So entering into the field, I think picking your career can always be a little daunting, but I love the fact that in mental health, there's so many opportunities, even along the road. Like even at this time, I would consider myself kind of a generalist, which I think is pretty important if you're gonna work in a rural area, because we don't have access to a large population that I could specialize in one thing and still make enough money to survive. So I see everybody. In private practice, at least I did. Right now I work for the school districts. So a lot of kids and their families on occasion. But at a bachelor's level degree, which I did practice to some degree in for a while, I took a break in between my educational goals. But with a bachelor's degree, so your 4 to 5 year undergraduate degree, you can do what's called a behavioral technician, which is so if I'm in private practice and I have access to behavioral technicians, if I'm, for example, working with a family and we're setting some goals and I'm doing some parent training and specific activities to help them have a better family cohesiveness, a behavior technician could take those goals and actually meet with the family in between our therapeutic sessions and help them figure out how to get those goals completed. So let's say if we're working on timeouts. Timeouts can be really hard for parents who don't, have never used them, let's be fair. And so the behavioral technician can go in outside of a clinic setting. They can go into the home and help demonstrate or model some of those goals and expectations and help just reinforce the family, be like, hey, you're doing a really great job with this. I would tweak maybe a little bit here, or just, sometimes we have families who nail it, right? And they can go in and validate that and be like, you're doing a great job. Look how great things are right now. What is the next step that you think we can take? And then they can report back to me. And so it's a little bit just kind of a helpful thing, because in clinic, when we're in a clinic setting, it's a clinic setting, right? So when we're working with families, sometimes having someone that can go into the home and help out is a little bit better, right? Because then they can see some of the at-home stressors, they can see some of the things that are going on. If there's some level of dysfunction in the home, they can report back to me and then we can address that a little bit differently, or they can help modify and show them how they can actually be successful, even though it feels like there's a boundary in the way. Program specialist. So one of the careers that I had as a bachelor level provider was I worked for Head Start as a mental health specialist. So what that looked like was I was in charge of making sure and going through all of the mental health screeners for our students, which was a lot, because I was in Houston at the time, so big grantee, big service area. But going through those, talking with parents if there were any concerns, being available for teachers to call or site managers to call and be like, hey, we have a behavioral concern, can you come help us out? And I would go, and I would help figure out what was going on, help modify the situation, and help with behavioral correction in the facility. Family support worker, another one that typically goes along with Head Start, but also Region 1 out here in rural Nebraska has programs that, again, go into the home, help with facilitating goals, help coordinate care for our families and kids. Substance abuse counselors. So the drug and alcohol counseling has a licensure. Drug and alcohol counseling is different because it has different levels of licensing. So if you are interested in that particular field, I want to say it starts at high school. And so what it does is kind of like a scales, right? So if you have less education, so let's say high school, then when you go into this field, you have way more hours that you have to complete supervised, which is the provisional license. And then the more education you get, the less hours you have to, and then it just kind of goes this way. So as a master's level clinician, I'm probably about right here, and I would have to do about 2,000 hours for that license. If I have a doctorate, I don't know how many hours it is, but it just evens it out. So more education, less hours, less education, more supervised hours. That's actually a really heavy need in the Nebraska state. So if that is a population that you're comfortable working with, because it is a very specialized population and they have their own kind of unique issues, it's solid work, and it's good work. And then CPS typically is bachelor's level. So anything along those lines. And they typically go with the social work route from my understanding. So I'm not 100% sure. And it might be more along the lines of in a higher population area, they hire mental health. But bachelor's level degree, they hire those as CPS workers. So the people that go, again, going into the home. It does sound like the higher your education, the less personal it gets. Not 100% true, but kind of. And that's just a couple. There's a lot of opportunity for, and at bachelor's level, it's not necessarily mental health, right? It's typically your psychology degrees. It's any of your human service degrees. So any subject that has to do with humans falls within that category. So master's degree. So again, depending on where you go, master's degree for mental health is going to be roughly 2 years. Not horrible, right? Unlike bachelor's, when you get to your master's degree, I didn't have to take math. I didn't have to take history. I didn't have to take science. When you get to your master's level, it's very degree specific classes. So then you kind of shorten it because you don't have to take all the extra classes. So as a master's level, there's different licensures, right? So on your screen, I am the first one. So licensed mental health practitioner. So what that means is once I get my master's degree, I apply for a provisional licensing. So again, that's supervised time to make sure I know what I'm doing. And that's 3,000 hours, which sounds like a whole lot, but it's broke down in 2 different pieces. So 1,500 is required to be face-to-face with clients, and the other 1,500 can be supervision with your whoever you're supervising with. It can be case studies with other clinicians. It can be research. It can be other classes. It can be trainings. It could be kind of anything paperwork or non-direct client content, but it has to be mental health specific. Like you can't just count 1,500 hours and not do anything. It needs to be some level of a learning experience. It just, only 1,500 of it has to be client face-to-face. And even client face-to-face doesn't necessarily mean that you're the counselor in all those situations. It can still be observing. So being in the room with a client and another therapist, but observing the situation, or being part of the mental health team addressing those clients. It just has to be direct contact. So 3,000 hours typically takes about 2 years if you're working fairly full-time, which isn't horrible. It goes by super fast. The LADAC is what it's called. So the licensed drug and alcohol counselor, again, at a master's level, it's the same requirement as the license I have. So if I have to do the provisional licensing before I get full licensure. So again, at a master's level, it'd be another 2,000 hours. Here's the caveat between the two of those. Because typically at a master's level, if you're getting your drug and alcohol counselor degree, it's the same as your mental health with just a few added classes. So I did that. And what you can do is if you find a place or find a treatment facility and you're doing your hours that qualify for the drug and alcohol, because it's a little bit different, it has to be content specific, you actually will get the hours for both licenses. So if I would have done my provisional hours with a drug and alcohol licensed provider, I would have been qualified for dual licensure with both my LMHP and the LADAC. But because I didn't, and I did the LMHP instead, now I would have to go again and do another 2,000 hours to get my LADAC. So again, these are the things that it's all about conversation. Just ask questions. We as providers are more than willing to give as much information as we possibly can, because what we know is that once we're in it, we know all the things that we probably should have done differently. So please ask questions. So next licensure would be the LIMHP, so Licensed Independent Mental Health Practitioner. And that means, so on top of my LMHP, I've either taken, I think now, there's a couple of classes you can take to get that pretty quickly, or what it used to be, or I'm not 100% sure, but I've heard things have changed. But when I graduated, I had to do a specific set number of hours working with significant mental health disorders. So your personality disorders, your pretty significant depressive disorders, not low level 6 to 7 sessions with a person and they're better, kind of lifelong mental health diagnoses. So bipolar, PTSD, major depressive disorder, schizophrenia, those kind of heavier, consistent cases. I would have had to have done a specific number of hours with those higher level diagnoses in order to qualify for the LIMHP. So the difference between those two is really not a lot. The only things that the LIMHP can do that I can't do is the mental status exam. So a lot of insurance require us to do what's called the mental status exam. And so for me, because I don't have the I, a doctorate level has to do mine. So a psychologist, psychiatrist, or a med doctor can do it and just document it. The other thing is it's just a billing thing. So when we see clients, the first session that we see a client is called the biopsychosocial eval, which just means I ask them a bazillion questions about their life and everything that has gone on in their history and their family history. And, so I just go through a really significant intake interview to kind of get a glimpse at who they are and what they have been through to help me create a treatment plan. So I can only bill that as a regular session, whereas an LI or a psychologist or psychiatrist can bill that significantly higher. So we're still doing the same things. They just get a little extra money off that, but they've also had to pay a little extra for that license. So if I was in private practice, I probably would have, I've just been lazy. I'm gonna be 100%. School counseling has their own license, and they have a little bit different master's level track. They take a lot of the same classes that I did, just the general counseling degree. They have a couple of classes that are school related, school government. I'm not that, so I don't know. But I know I looked into it because I'm in schools now just to see if that was something that would be helpful. And it's like 15 hours, I believe. I would have to go and take, so I think that roughly comes down to like 5 classes, and that includes an internship. So a little bit different, not a lot. School counselors do not do a lot of therapeutic work. They are doing scheduling, they're doing kind of evaluations to see if this is something that can just be talked out at a school level or if they need to be referred to a higher level clinician. APRN, psych nurse practitioner. So nurse practitioners, in my understanding, don't want to make anybody mad, is a master's level nurse, and there is a specialty for psychiatric nurse practitioner. And so they would be, what they would look like is a step down from a psychiatrist. So they're doing roughly the same work as a psychiatrist does, which is an MD, medical degree. So they're still in medical, but they're able to do and function within the psych med field. So they can take clients and they work on, med management. They help with just prescribing medications for some of our clients. And out here, like in rural Nebraska, I think we have 2 psychiatrists and 2, maybe 3 APRNs, and I'll get to that. There's a map that shows you kind of where everybody's located. So if you think about how, like, half the state, if you half the state roughly around North Platte and over into the Panhandle, there's, I think, 4, maybe 5 people that can prescribe psych meds outside of your primary care doctors. Because, and what we run into out here is that, and probably everywhere, is that our regular medical primary care doctors are comfortable with a certain subset of psychiatric medications that they'll try with you. And then they refer you to a higher level of care, which would be your psychiatric nurse practitioner or your psychiatrist, because those are very specialized medication fields. All right, so then you go into the doctorate level, which is roughly, so here's the caveat. If you are interested in going into a doctorate level in any of the behavioral health fields, I personally recommend that you do that in a combined setting. So as an example, because I've already got a master's degree, if I wanted a doctorate, I would have to get a second master's degree during the time that it took me to get my doctorate. So if that's even remotely on your list to do a doctorate level, go from bachelor's straight into a doctorate level program. I do not recommend getting a master's degree. So you can, you absolutely can. Don't think you can. I could totally go back to school. But my current master's degree would only transfer maybe 6 to 9 hours. They don't take a lot of those credits and transfer it into a doctorate program simply because they're very track oriented. And so they want to know and make sure that you're on track. And the only way to really do that is to do some really heavy, significant evaluations, which they don't have a lot of time for, or they just put you on this track and make sure that you have exposure to all these things that they want you to have for that degree, if you look at it that way. So doctorate level degree, obviously there's two tracks. Psychologist, which is therapeutic based, but there's 2 within that one, right? So psychologists you'll either see in a research setting. So they're the ones doing all the research. They're the ones that don't necessarily see a lot of clients because they're running evaluations. So if you think a lot of our schools have school psychologists. So I know out here, I don't know in major cities if it's different, but I know out here, they're the ones that go into the school, do all the assessments, have the meeting, talk to parents, decide what programs or what modifications those kids need if they're going to have an IEP. And then we don't see them again until they're back in doing some assessments. So they do have some client contact, but it's usually assessment based and meeting based, and then they're off to the next one. So diagnostic criteria, therapeutic intervention recommendations, and then they're kind of gone. They don't typically see the process through, which is, it works for some people. The other track for psychology is the actual therapeutic part, where They work within clinics. They see clients. They are doing the same thing I'm doing. The difference is that with a doctorate, you can do more evaluations. You can do assessments. So you can assess for ADHD. You can do the bigger personality assessments if you get trained in those things. You can do the autism assessments. There's even some for specialty stuff. So I know out here some of the, it's everywhere, but I know some major surgeries require like a psychological assessment before they will schedule you. So that's an opportunity too. So again, if you do the therapeutic track for psychology, and there's a couple of different degrees, and I'll talk about that too, but you're doing the same thing as a master's level technician or master's level provider, so myself, on top of the opportunities to do more evaluations, more consultations, right? Because people will call me in, but I don't have a doctorate. So it's kind of just another level of respect in that perspective. Plus you've got more training, right? You've got more education, you've got more training than I do. So that's kind of the big difference. Plus they do a lot of training of practitioners. So like I did my provisional licensure and my internship under Dr. Kate Jones Hazeldine at Western Nebraska Behavioral Health, which was super helpful because her and I's therapeutic alliances line right up. And I got to learn from somebody who had a higher degree than me. But I mean, there's no but. That was great. But I can also supervise. So that's something I didn't put on there. So, and that's something I'm going to start doing potentially, I think in the fall, is working with Shadow State College and having master's level students come and shadow me and then doing case studies and stuff like that. So 2 different degrees for psychologists. There's the PhD, which is a little bit more research-based. They have to, so the big difference that I'm aware of, I'm not a professional I'm not a psychologist. So what I know is that the big difference between the PhD and the PsyD, which is a psychological degree, versus a philosophical degree, I think is what they stand for. The PhD has to do the big research paper, the thesis, at the end of their doctorate degree. And so they have to conduct their own research and do this huge write-up and then actually defend it. So they turn it in to their governing board there at the school, and then they have to actually answer questions in an interview style based on their research, and it's either accepted or it's not. So that's kind of a big stressor for that particular degree. And my understanding is the PsyD is a little bit more evaluative based. So their curriculum is a little heavier on learning how to do evaluations, to do this assessments, the different psychological assessments, and they do not have to do the thesis. So something to think about. They can function within the same capacity as far as I'm aware. They sit for the same licensure. All the requirements are the same. Okay, and then the other doctorate degree, I feel like I'm kind of rambling, sorry. But the other doctorate degree is the psychiatrist. Now the difference between psychology and psychiatry is psychology is a PhD or a PsyD, and the psychiatrist is an actual medical degree. So they go to medical school. They are a medical doctor. But a psychiatrist typically works in an assessment-based situation, and they typically work with psychopharmacology. So you'll see them either in private practice where they see and help with med management and prescribing of psychological drugs, or you see them in hospital settings doing the medication and some of the assessment-based stuff in psych treatment centers or hospitals that have like a psych unit. That's typically where you see them, and that's kind of what they do. They do not typically do therapy. They'll do a little bit, with that intake assessment to try to get a little background to do understand a little bit, but otherwise they have really fairly quick appointments, and partly because they're in high demand. So if you're not scared of medical degree, get her done because we need them. But that's, as far as I know, that is their main kind of box. Is a lot of med management, some assessments, And that's kind of it. They don't do a lot of therapeutic intervention. So if you enjoy kind of the give and take of human interaction, it's a little, you would prefer a little bit more therapy versus kind of just a quick, okay, diagnosis and assessment, and here's some meds, come back in 2 weeks, let's see how it's doing. I know I'm selling that a little short, but part of it is because that is not, it's not my lane. And if anybody has an interest in psychiatry, I can totally set you up with somebody who probably has better information. But again, medical degree, so you're going to med school, you're just specializing in psychiatric treatment. So next slide. Okay, so now that you know all the things that you can do with a mental health degree, what is it? So mental health is, and here's the thing, there's a huge difference between mental health and mental illness. It is two separate things. That is the big deal. So mental health is anything that has to do with your emotional, psychological, and social well-being. So how you interact with others, how you talk to yourself, what's going on in your head, and how you feel is your mental health. And it can be good or bad, right? And we all have good and bad. It's not one thing. There's nobody that is happy all the time. It's just not a thing. And mental health affects everything. It affects how we act, how we feel, how our thoughts go. Have we ever had days where it just feels like doom and gloom, where all of our thoughts are like, ah, this is going to happen. And it happens. And it, you know, we have those days where it just feels like everything's going wrong. That is an indicator of your mental health. That day is not a good mental health day. We have days where things just, you know, you wake up and you're like, it's going to be a great day. That's a good mental health day, or at least a start to it. But it determines how we handle what we come in contact with, right? So if I start out the day with good mental health, I am going to handle stressors a little bit better, potentially, right? If I kind of wake up and I feel like crud, I'm not going to handle stress well. I'm not going to handle anything that's kind of combative well. I'm not going to handle just life super well that day. So those are types of things to think about. So how we think, feel, and act is our mental health, okay? So it's pretty broad. So over the course of our life, right? Everybody has mental health problems. Everybody has mental health issues, period. The difference is that some people have enough or a significant enough amount of issues that then it becomes diagnosable. But everybody has depressed symptoms. Everybody has had worry. Everybody has felt sick in the pit of their stomach about something that's coming up or something that has happened. Those are all symptoms of mental health. So when we think about mental illness, the difference is the level and significance and the amount of symptoms that are happening in a specific time frame that would require a little bit of help. Okay, so when we think about mental health problems, right? So when things aren't going well and we have kind of a consistent not going well pattern, we look at different things, right? So biological factors. One of the things everybody worries about is if, let's say, my mom has depression, diagnosed. So she's got enough symptoms over a specific length of time to qualify her for a major diagnosis. What does that mean for me? It means that I roughly increase the likelihood of having the same diagnosis 15% over the general population. So what that looks like is if Sally, who has absolutely no family history of mental health, has, let's say, 30% chance. I don't know what the statistics are to be 100%, but here's the comparison. So if her chance of having a depression diagnosis is 30%, if my mom has it, it only increases my percentage of likelihood of getting it to 45%. It's not a 50-50, right? So if you know anything about genetics, typically we get half of our stuff from mom, we get half of our DNA from dad, and here we are. It doesn't mean that we're at a 50-50 chance, because the mental health related genetic makeup is not it's not such a heavy hitter that you get a 50% chance. So if you have a significant mental health disorder in your family tree, it has to be a first relative, so your parents, and it only increases roughly 15%. And that's pretty consistent for any diagnoses. So it really doesn't, everybody worries, right? If our parents have it, like, oh, it's me. Mental health in itself is more likely to be passed down generationally because poor coping strategies are taught versus a genetic factor or a biological factor, okay? So life experiences increase our likelihood, right? So if me and you, and a general you, saw that, or we're in the same traumatic event. So let's say me and you are driving down and we get into this horrific car accident. Our experience with that car accident and our symptoms following that car accident can be very different. I could have PTSD and you could just not have any problems, right? I could have nightmares and you might not. You might have anxiety about getting in a car again and I might not. So there's no like set thing when it comes to mental health that determines that you're just good luck. You know what I mean? Mental health is such a cool thing. And here's another reason why I love it is because it's so many things that have to fall just right for each person, right? Because everybody's different. Everybody is so different in how our brain functions and our life has gone and our experiences have changed us and everybody's lineup of potential things is so different to get them to this one place where they are diagnosable. So it's just super cool. So one of the greatest things about my degree or my job is that I never know what I'm going to walk into. And I love people puzzles is what I kind of call them. I don't like puzzles on the table, but I love figuring people out. I love asking questions, and anybody that knows me knows that I have a lot of questions. But that's part of the process because everybody's so different. I can't just check off these boxes and be like, oh, here you are. But to be fair, diagnoses have things, but there's usually like 9 or 10 things, and you have to fall like 4 to 5 of them in order to qualify for that diagnosis. So what does that tell us? So if there's 9 symptom things that I have to only check off 4 to 5, everybody's so different and everybody's combination is going to be some level of different, which is super fun and cool. So, and then we did find family history. So let's go back. So the biology thing is also how your brain distributes chemicals. So we talked about the genes part, right? So one of the reasons why a lot of people say, if you're going to do psych meds, it's going to work better if you combine medication and therapy, because medication will only take care of the brain chemistry piece. So if we determine, and you've done all these things in therapy, and I'm not going to tell you that you can't go and talk to a doctor about trial medications. Do whatever you want. But honestly, if I see a client for a while and they're trying new things and they're doing different things and we're just not seeing a lot of improvement, one of the things we talk about is like, this might be a brain chemistry issue. Maybe your brain's not giving you the good hormones to help come out of this. And that could be an indication that medication might be super helpful, because now I know that this individual has the motivation to make changes and it's still not quite getting us where we need to be. Medication might be that last bit that just helps us get to the sweet spot. So the brain chemistry piece is really where psych meds come into play, because if your brain is not releasing the feel-good chemicals the way it should and when it should, the psych meds can help that. All right, so one of the other great questions that has come up from our GSEC girls, and I love it, is how can they be helpful? How can I be helpful? So the big and easiest thing I can tell you to do is just listen. Just listen. In clinic, in therapy, I don't always talk a lot unless I have specific questions or I'm like, whoo-hoo, so was that a good choice? A lot of it is just listening, hearing their story, validating their feelings. That one piece is huge. Huge. Okay. A lot of people think that as a therapist, I talk a lot. I do talk a lot, just not necessarily in clinic. And the next thing is paying attention, right? You young ladies are at a place where you guys notice things that parents and adults don't always notice, pending our level of interaction with you guys, right? So if somebody's struggling with some mental health issues, what do we notice, right? How they dress, how they take care of their body, right? Bathing, cleanliness, and clothing, big difference sometimes. Not always, but sometimes. If we're not feeling super great about ourselves, we're not going to be super motivated to take care of ourselves. Or sometimes our mood is reflected in our clothing choices. Maybe I'm usually bright colors and flowers, and then all of a sudden I'm wearing a lot of black. Is that in 100% a mental health issue? Not always. Sometimes we're just checking different things out. Maybe whatever. But again, so this is a list. They don't have to hit each one. It could be a combination of any of these. So watch for how they appear, how they look, how they're dressing. Social behavior. If I am typically super talkative and seeking out social interactions, and then all of a sudden I'm not talking to anybody and I'm avoiding social interactions, that's a big change, right? And it's typically the pulling back from social interactions. It's not typically the I'm shy and keep to myself and all of a sudden I'm just, but that does happen. It's just not like typically what we see as a concern. It can, don't get it twisted. So our social behavior, going from either shy and not very talkative to super talkative and interactive, or the opposite, being fairly social and then all of a sudden avoiding social activity. Eating habits. And a big one for girls, and boys do it, but it's a huge one for girls. When our mood is crap, it's not uncommon for us to either eat our feelings or avoid food altogether, right? So it can go either way. Again, increase in intake of food and liquids, or a complete opposite, and all of a sudden we're skipping meals or we're eating very little. Sleep patterns, that might not be something that you know specifically about somebody, but dark circles, you can look for dark circles, yawning, sleeping through classes, that sort of thing. But sleep pattern is huge for all ages. Sleep is so important, so important. Sleep can affect mood so significantly. Like I can't even tell you how big a deal sleep is. So another thing to kind of pay attention on, and here's the thing, these are all things that you can self-reflect on too. This is not just something that I want you to go and check out the your friend group with. This is something to pay attention with yourself. I notice if I don't get, adequate sleep, I am a grouch. And the opposite is true too, right? If we're sleeping too much, we can feel sleepy a lot more than normal. So it's not always just a lack of sleep that makes us feel crappy. Sometimes it's oversleeping that can make us feel yucky. Energy levels change. And this is, again, one of those ones that can go either way. Either all of a sudden we don't have the energy or motivation to do any fun or exciting activities, or, we're avoiding, again, that social piece plays a part here too. Like, I don't want to go and shoot hoops. I don't want to go for a walk. I don't want to go hang out. I don't want to do all this sort of stuff. I'm too tired. Or we're over exuberant. We have all this energy and it's just like, I gotta do. So again, pretty significant. And again, it's not black and white. There's a lot of gray areas in between. And sometimes that's where we miss, specifically our younger kids, is that you guys have these really small changes. And we as adults don't always notice it because it's not obvious. It's not super obvious. And then mood changes. So we talked about mood a little bit earlier with the mental health piece, right? Because mental health is how we act and interact with the world. So when we talk about mood, it's how you feel, right? So significant mood changes. If I am feeling yucky and just down and don't want to be bothered for, more than a couple of days, that we got to talk about that. You need to talk to somebody about it. Be like, I just kind of feel bleh, right? I feel like blah, there's nothing there. Like I'm not responding to the world the way I should be. That's a concern, right? Something's going on. Let's figure it out. And then the opposite, I'm super grouchy, I'm super irritable, or I'm just super hyper, or I'm super so mood changes. And again, lots of gray area there. Okay. Identify trusted adults. So this is a really big one, right? And it's a huge one for younger kids, right? Not all of you are going to trust your parents. Not all of you love your school counselor. Not all of you feel like you have somebody to talk to. Always have at least one. I don't care who it is, just somebody that you trust and feel comfortable telling anything to. That's a hard one because I can tell you honestly that not every adult is going to respond to this level of information in a helpful manner. Sorry. So it's important, and you guys are so good at perceiving adults. I just want you to have one. If you can't find one, find somebody in Girl Scouts who will find me for you, please. It's so important. It's so important because if you guys struggle with any of these things, and it gets to be concerning and you don't feel like there's anybody you can talk to. But here's the thing. If you are doing fine and you don't feel like there's anybody you can talk to about any of this sort of stuff, like let's say you have an off day and you just, and your mood's kind of gross and you just, right? And even if it's just one day and you don't feel like you have anybody you can talk to, imagine how awful that might feel if you do slide into a dark place, right? So while you're feeling good, and hopefully you all are, because I want the best for all of you, but even when you're feeling good, try to think about at least one person. I would love for you to have two, but at least one person that you can talk to, and make a mental note of who that person is. And I don't care what that looks like, right? Slide me a note, send me an email. You know what I mean? Like, it doesn't have to be like a one-on-one conversation where you're staring somebody in the eye and telling them how awful you're feeling, because that's hard. It's not easy. And that's one of the really cool things about what I do is I can tell them, like, I never expect people to just how awful things are to me. Like, I expect there to be some trust building exercise to therapy to get us to that place, right? And there's some people who do, they just come in and dump truck or word vomit all over me. And I'm like, all right, let's dig through that and see what's going on. But there's some that take several weeks to get there, right? Because they have some trust issues. So please, homework. I just want you to have one person. I don't care what it looks like. I don't care if it's me. I don't care but an adult, one adult that you feel would totally have your back if something was going on, or would be helpful if something wasn't quite right with your mental health. Please and thank you. And then if somebody tells you that they aren't feeling great and things just haven't been going well and you're worried about them a little bit, be like, hey, I know somebody that I think can help. Will you come with me and talk to them? Or ask them, hey, do you have a trusted adult that you feel comfortable talking to? I'll totally go with you. But make sure, the trick is going with helps them feel like they're not alone, but also, then that you're kind of handing the torch, right? Like, if somebody's comfortable talking to you about how they're feeling, that's awesome, okay? And it's a huge responsibility. So as another child, or young person, I never expect you to feel like you have to be the therapist. But please tell. A lot of times what we hear is, well, I didn't want them to be mad at me. I would rather them be mad at you and get some help than things get worse and then the worst possible thing happens, right? Always tell. And but here's my thing. I'm honest to a fault. But I think that's a big piece of building trust, right? So my friends will tell you that they don't always appreciate the things that I have to say, but they 100% know that it's honest and truthful, and I'm there for them if they need me. So as an example, right? If I have a client who tells me that they're suicidal, I'm 100%. I tell them exactly how I feel about it. If I'm super worried about it, or if I feel like it's just kind of we're at the beginning stages and we need to watch it and monitor it, like I tell them where I'm at so that they know how I feel. They know that they're transferring it. They know that I'm listening. They know exactly where I'm at. Because if it does get to a place where I have to move on to what most people think is a scary thing of being hospitalized, I want them to know I'm not going to spring it on you. Right? So I want you to be able to tell that person, be like, you know what? I'm kind of worried about you. Can we go talk to a trusted adult? And if they say no, that's fine. Be like, here's the thing. I appreciate your opinion and your choice there, but I'm going to talk to my trusted adult and make sure that somebody checks in on you. And they don't have to like it. They don't have to like it. But most people aren't going to be super mad that you care about them. To be fair, they may not like it in the moment, but they'll most likely come around. And at the end of the day, you have to do what's best for you. And if you're super worried about somebody, you need to not just hold that. You need to be able to talk to somebody about that too, because that's too much responsibility for somebody who's not trained to take care of other people. Okay. So here's all the numbers, right? So we talked about how Nebraska is in a high need. So if you're interested in this career choice, by all means, hit me up because I can help you get into it. I can hook you up with people that'll make sure that you've got the best training on the planet. But here's some of the statistics, right? So this is a huge map of Nebraska. And if you look at my numbers here on the bottom left, red, specifically the dark red, means they need some help. So I'm out here in Box Butte County. So I don't know if you can see my little cursor, but I'm right here where I'm in the orange. So there's not a lot of us. And I want you to take into consideration too, I don't think that this counts school-based providers. So these are private practice or in business providers that are working with general population, is my understanding. So like I'm not counted in these numbers right now because I'm no longer in private practice. So stats, nearly 1 in 5 Nebraskans have a mental illness. That's a lot, okay? So you got to take into consideration that Nebraska is a very rural state, but also very agricultural. So when we have crazy weather, like last year, our weather was super crazy. And crops were going and flooding and all this other stuff. That's a lot of stress. And look at, there's not a lot of people that can be helpful, right? So just something to think about. And then the next biggest one that we talk about out here is 81. So Nebraska has 93 counties, right? So all these little boxes, there's 93 of them. Only 81 of those, or no, what is that? 81 of them don't have enough. So your orange, your dark orange and your red, look at how many of those there are. All of those are underserved. They do not have enough providers per population in those areas. So there's a lot of opportunity here in Nebraska if you're interested. And then the big red one, right? 33 counties have no behavioral health provider of any kind. So those are your dark reds, right? None. Now I want you to look at something too. So those of you who are maybe on the eastern side of the state, how many of our counties have green? 2, Lincoln and Omaha, right? So the only 2 major cities in Nebraska are the only 2 that have adequate coverage. And I will tell you up front, I borrowed these stats from the Behavioral Health Education Center of Nebraska, who are amazing at trying to make sure that providers across the state have access to quality training. They are trying to work with our educational system, or higher ed educational system, so your collegiate level education, to get more providers out here, figure out how to keep us out here, right? Because one of the things that happens in your provider group, so whether it's medical or psychological, is we'll have incentives to bring these big city folks out here, right? Like, come work out in rural Nebraska, we'll pay off your loans. And then they get out here and what do they find? We do not have a Target very close by. We do not have Starbucks on every corner. We don't have a lot of entertainment options around. Like, here's the thing. If you're born and raised in Nebraska, you get used to it. But if you come from a city where, you know, everything is at your fingertips and not a very far drive away, and then you come out here, you're like, oh, what is this desert land of no fun? So we get a lot of providers that'll come out here, stay the couple of years that it takes to pay off their loans, and then they're going back to a city, right? They're going back to city. So what we have found out is that if we can kind of keep our own homegrown folks out here and figure out how to incentivize them to stay, we have a better chance of having long-term providers in our area. Okay, so general stats there, provider map. And now I'm going to break it down a little bit. So LMHP, so master's level practitioner, right? Breakdown, there is 783 as of 2016, there were 783 of us in the state of Nebraska. 84% were female and 16% were male. So I know we're all girls here because it's Girl Scouts, but it is a very female-led career. It just is. There's a couple of reasons for that. You know, we're born with some level of increased communication skills in our brain, and that's scientifically proven. I'm not just making it up. Women in general are better brain-wise communicators. Sorry, I'll stutter. We're just hardwired a little bit better than males to communicate verbally. Okay, so that's one. So communication a little bit easier for us. And the other thing is that we're kind of raised and chemically created in some level to be, not all, but most of us have a little bit more of a nurturing characteristic. So that's the other part too, right? So you can't be in my field and not like people. I joke all the time that I don't like kids. It's not true. I just like them in very small doses. So you have to have a level of nurturing. You have to have a good handle on communication. And as women, we're just a little bit more wired for that. Not to say that we don't need men out here, right? Because, you know, we've got these guys out here, they'll walk in and be like, I'm not talking to her. She won't get it. So there is a need. It's just men are not, there's some, and they're great, but they're just, it's just not as easy as a fit for them as it is for us. So very female-led career. Psychologist, state of Nebraska, 2016 numbers, there were 355. This evens up a little bit differently, right? So psychologists have a little bit more scientific grounding in their degree process, right? They're doing more research. They're doing more like clear-cut thinking, okay? So then that's when you start seeing the increase in our guys, right? It's research-based. It's very factual. Women do gray areas a lot better than men do. Men often have a little bit more black and white thinking, whereas us women we run the gamut. We can do straight up black and white, and we can do a lot of the gray in between because our brain connectivity is different. But so when we get up to that higher level of education, you see kind of the gender even out just a little bit more. We're still ahead, still a female-led population or career choice. Psychiatry flips. And so, because if you remember correctly, psychiatry is a medical degree. So science, math. How many times have you guys heard that math and science are typically more male-driven degrees, unfortunately? And that's not to say that women can't do it. We can do it. And I'll be the first one to tell you, I love science. it is a super hard subject for me. Like, I get it, I can talk about it, but doing like the written work and reading about it is difficult for me. So it's just a matter of, and I think as a population, we're doing a lot better at not excluding women, and specifically Girl Scouts. I love that we do so much STEM stuff. So STEM, there's two different ones. I don't know the difference. But you'll see, so we get into that math and science piece and men start to dominate the field. So, but again, look at the number, only 164 in the state. And I can guarantee you they are not on our side of the state, my side of the state, I should say mine. So another thing to think about, right? There's only 164 psychiatrists in the state of Nebraska as of 2016. That is not a lot. It sounds like a lot, but it is really not a lot. When you have 700 plus master's level clinicians and only 164 specialty psychiatrists, if even a third of my clients need medication management, that's still more clients needing meds than we have psychiatrists. So thinking about the numbers, that's a huge underrepresented career path here in the state. So, okay, so here's your map, right? Primary and satellite locations. So if you look, so again, where's that? Lincoln County is the North Platte area, right? So this, hopefully you can see my little thing. There's a handful of them in Lincoln. There's one out here in Cherry County at the top middle, and then there's just a couple over here on the Panhandle side. And then if you go to the right of your map, you start seeing a little bit more representation. And again, this is specifically psychiatry. So that 164 number we just talked about, this is their dots. This is where they're at. And if you look at Lancaster County right there. There's a boatload of them in Lincoln. And then Omaha area, there's even more, right? There's a ship of them over there. And then there's a good sprinkle of them in the eastern side of the state. And then it gets real sad on the west side, where I'm at. So I wanted to show you where everybody's at. So what that means is that if you're interested in this career path, if you look at the midline of our state and to the west, massive amounts of opportunity. That's all I'm going to say. So non-prescribers. So this is anybody who's a non-prescriber. So this is your master's level clinicians and your psychologists, right? Here's how we are distributed across our state. So again, if you look at that midline, and I'm looking at it as like that Custer County right there, schmuck in the middle. To the left, not horrible, right? It's better than the psychiatry. But again, this is two levels. This is both master's level and psychology and the drug and alcohol. So this is everybody who's not psychiatry on this map. So if you think about that and think about the fact that there's 3 levels of providers on this map, it's still pretty slim, right? So again, that midline, Custer County to the left, pretty sparse. Several counties don't have a provider of any kind in them, right? Sioux County up in the top left, Morrill County right there, which is not true. I know there's a clinic there. But this is again, 2018. So, because I worked in Bridgeport, I think in the beginning of 2018, which is in Morrill County. I was at their Morrill County Hospital actually working. But again, if you look at that midline to the right, a lot of color over there, right? Pretty sparse. Couple of counties that you can see don't have a dot in them, but they've got surrounding counties that do. There's counties on this left side of the map, they don't have a provider, and there's not one in the surrounding counties close, right? Because Cherry County is huge. It's a huge part of the state. So again, lots and lots of opportunity out here. Okay, so I didn't bore you with maps, and hopefully I covered quite a bit of the career process. So again, we are planning on a little bit more mental health specific, not necessarily career specific, but mental health in general, diagnostics. Oh, here we go, I listed it. So our upcoming program, the VIP program for next month, is I'm going to cover common mental health diagnoses, coping strategies and what those look like, how our current events are impacting. And there was a lot of questions from our the GSAG program I did earlier in the week about that. And it's a big deal. And I think we're doing the best we can to address it. I know, like I said, I work in the educational system, so we're looking at it, we're worried about it. We're talking about assessments and how we help out with that. Our schools, from my understanding, have not come out with a clear-cut plan yet on how we're coming back to school, simply because we're waiting to see what happens in July with things opening up. We're worried that, you know, the worry is that we will have more incidents of illness. And so July will dictate what happens in August. So right now what it looks like is we're planning for 3 different outcomes, right? So going back to school as normal, going back to school with a lot of things in place to help keep everybody safe, right? So like your masks and cleaning and assessments and how that looks and what we're gonna do to help, and then delayed start or starting from home. So as of right now, we're looking at all opportunities and seeing how we're going to address that. The other big issue in the news right now is the Black Lives Matter movement. And so we're going to talk a little bit about that and how that looks and how it's affecting everybody. I love that we're talking about that. And I will tell you that my daughter is mixed. So it is a big subject for me. And I've been keeping somewhat in the know. There's just so much going on that even I can't keep up with it. And unfortunately, our news programs are not 100% accurate. They tell what they want to tell because headlines sell. So there's a lot of research that goes into staying in the know. And there's only so much time in a day, unfortunately. So I'm keeping abreast of that information as much as possible. We can talk about that in general and ask questions. I'm not going to have all the answers, and I don't think anybody does, right? But we can work together and come up with ideas on how to be better, better citizens, better friends, better educated, and that's the big one, right? When it comes to racial issues, the best thing we can do is educate, because ignorance is a choice. And then again, looking in depth at how we can be helpful. So, and that's all of it, for mental health, for ourselves, for the community at large. Sorry, there's a really loud truck outside. All that, and then hopefully have plenty of time for questions and answers. And if any of you are returning from the GSAG meeting, I love questions. I think there's no such thing as a bad question. And I was taught that at an early age, and it's probably why I have a lot of questions myself. So I love your questions. Don't feel bad about asking anything, because again, there's no such thing as a bad question. And 100% of the time, if you're thinking about it, somebody else is thinking about it too. And they just might not be as comfortable asking questions. So I always say ask them, because you never know. You never know who you might be helping by asking your question. So I think I've covered everything today that I was supposed to. Again, this is for the Girl Scouts at-home programming, and I'm super excited that this is a subject that you guys are interested in, and it just makes my heart full. Again, I love that I'm here, and I love that the girls asked for this kind of input. I hope that I can be just a fount of information. And again, if I don't have the answers, I know somebody who does, okay? Ask questions. I hope to see you next month for a more in-depth look at mental health. And I think I'm going to call it a day. Thank you so much for this opportunity, and have a great day.